Hi guys, it's your favorite nurse educator, MP Clark, and I'm back with another cup of the morning coffee, espresso shots. Okay guys, I'm reading from text. Hi MP Clark, this is so-and-so. I have a few labs to relay that I need orders for. I said, okay. Well, at this time I was driving, so I said call, but they didn't call. So later on she replied. So she said this person, she reported an abnormal valproic acid level, and the level was abnormal, but the lab was about 4 days old. So I wanted to repeat the lab because I wasn't sure if the patient had been refusing or what was happening. So I ordered a stat repeat and got some information there. So that was one. Two, but I had to ask her a few times for the date of the lab, when the last lab was drawn, the current dose of the valproic acid that the patient was getting. So that's something that we've got to fix, guys. We got to make sure that we are looking at those things before you call the provider, right? You want to make sure that you know what you're talking about. The provider shouldn't have to wait around for you to scuffle or to try to even sign in to the computer. You should have that information already. Why? Because it's something that you need to know. You need to know, has this patient been refusing their medications? Or have they been taking it? Or was it out of stock? Or was there a recall? Any of those things you should know as the nurse, because you are responsible for giving the medications. So what I would recommend, and actually this patient, I want to look at this, the valproic acid level was 31.4, which was a critical low level. And the bottom is 50. So it should have been 50, but this patient's was 31.4. Now, in hindsight, what we end up finding out is the patient does have episodes of refusing or whatever. But again, we need to have documentation, guys, that shows that. We should be documenting when the patient is refusing, and then letting either the psychiatrist team or the primary care team know that these behaviors are going on. So that way, when labs like these come through, maybe it's not such a panic if they're refusing, or maybe it's just about being creative about how we administer the medications. Maybe there's a certain person that they really like that they'll take the medications from, or maybe there's a family member that we need to reach out to and contact to get them to kind of schmooze them over to take the medications. And maybe sometimes it's about education. What will happen to you if you don't take the medication? And what are the benefits of taking the meds? So, these are things that we want to make sure that we are keeping track of, guys. So this has been MP Clark, your favorite nurse educator, with another cup of the morning coffee espresso shot.